Medical issues are tough to talk about, even with family members or the closest friends, the people who may have to make critical decisions someday about our care. We spoke with Dr. Diane Dietzen, Medical Director of Palliative Care Services for Baystate Medical Center, on the importance of healthcare proxies and making sure our wishes are known.
We often choose not to think about it and not to focus on it, and it's certainly human nature to do that, but then the consequences, we see many families in the hospital who think, oh, I wish we had had a conversation or talked about this differently ahead of time.
That really does happen a lot, doesn't it, where someone's in critical situation, maybe in the emergency room, maybe in intensive care, they're not able to speak for themselves and maybe will not be able to speak for themselves, despite all the greatest medical efforts and medical miracles that are available today. And no one close to them really has any idea what this person wants for care.
No, it's really surprising how often you turn to a family and ask that question and they say, you know, we never really had a good conversation about that. And so the conversation is critically important. Designating a person who's going to be the point person for your medical decisions, your healthcare proxy, is the first step in that process.
I think we probably can all think of a situation where we have said, or we've been sitting with a relative and something's on the news about someone who's been injured, they're on life support, maybe their family's now in court fighting over what to do, and invariably somebody says, oh, I wouldn't want to be like that. I wouldn't want to be in a vegetative state. Okay, but that's not really telling someone in a very complete way what you would like done.
Right. So there often are those remarks, right? I wouldn't want this. I wouldn't want to be like that. It's important to try to get beyond that in the conversation. I think that, again, the first step would be designate a healthcare proxy and then sit down and talk with that person, not just about I wouldn't want this or I wouldn't want that, but these are the things that are important to me. This is what's quality of life for me. These are the kinds of things I would want to be able to maintain. These are the kinds of tests and procedures I would be willing to go through if I had a critical illness, just in general terms, so that that person has an understanding of the general way you would approach a decision.
And there really is a real full legal process. There are legal documents. It's good to have a healthcare proxy, an advance directive or living will. These are things that sometimes can cost a little money to get done by an attorney, but you know then it's in black and white. It's in print for you, your family, your physicians to know.
So I'll just make a distinction. The healthcare proxy is a really simple one-page document that doesn't require an attorney. You fill it out, you designate a person and an alternate who would make decisions for you, and two witnesses sign it, and that's it. So anyone can do that by getting a document from their physician's office or printing one out online. So that shouldn't be a barrier to getting that done. If you want a living will or other documents that have to do with things other than healthcare, then you might need some legal guidance. But the proxy document and the conversation can happen without any expensive intervention.
Deciding who'll be your healthcare proxy, that's very important, because sometimes the people you think of as the very closest to you, a spouse, a child, a parent, very emotionally involved, you mean something to them, you're important to them, and even no matter what, it's in black and white, I want this, I want that, it still can be very hard. Maybe you need to have someone, a friend, a business associate, someone who's maybe a little detached.
People choose very differently. It certainly can be a family member. It can be a friend. You really need to know that person and understand how comfortable they would feel in making decisions. I have people say to me all the time, my spouse is not the right person for this. They'd be a mess. And so I've picked my sister, and I've talked with her because I feel like she has a good understanding of what I would want and could carry things out for me. It's different for each person, but you want to think about who are the people who would be able to best express themselves.
Without specific direction from an individual, without that healthcare proxy or the advance directive, the living will, very difficult situations can sometimes arise within families.
There can definitely be situations where there's disagreement or no one is certain who was supposed to make the decisions. And so families get into very difficult disagreements, again, at a time when they really need to be focusing on the person who's having the illness.
Thanks very much for your time. Thanks for coming in. We appreciate it.
Thank you.